The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to the Research Study Update webinar on psychological stress in pediatric cardiac patients and caregivers during COVID-19. Today's webinar is hosted by the Children's Cardiomyopathy Foundation. My name is Cindy Andrake, and I am the Family Support Manager here at CCF. If you're new to our webinars, we want to extend a warm welcome. If you've joined us previously, we want to welcome you back. We hope you find today's presentation helpful and informative. Before I introduce you to our presenters, I have some housekeeping information I just want to review. If at any time during the presentation you have technical issues, please type your concerns into the chat window on your control panel, and we'll do our best to address them. If you should have any audio issues or difficulty hearing, you should be able to switch to a phone-in to correct the audio. In order to provide the highest quality webinar session and to avoid any background noise, all attendees will be in the listen-only mode during this presentation. Questions are encouraged throughout the presentation, and we will reserve the last 10 or 15 minutes of the hour to answer your questions. You can submit your questions via the question box located on the control panel, which is on the right-hand side of your screen. If the control panel is preventing you from seeing the screen presentation, you can hide it by clicking the small orange arrow at the top left of the control panel. Last, we are recording today's webinar presentation and we'll post it on our YouTube channel, CCF Heart Kids, for anybody that's interested in accessing it later. With housekeeping reminders complete, it's my pleasure to introduce you to our presenters. Dr. Melissa Cousino is a pediatric psychologist at CS Mott Children's Hospital and Director of Psychosocial Services and Research at the University of Michigan Congenital Heart Center. She serves as the attending psychologist to the Pediatric Dad Heart Transplant Program. Her federally funded program of research focuses on psychosocial outcomes and patient and family communication and medical decision-making in pediatric advanced heart disease. Dr. Kurt Schumacher is a pediatric cardiologist and cardiac intensivist at CS Mott Children's Hospital and the medical director of the Pediatric Heart Transplant Program at the University of Michigan Congenital Heart Center. He also serves as associate director of the Michigan Congenital Heart Outcomes Research and Discovery Program and director of the Pediatric Cardiac Critical Care Consortium PC4 Analytics Center. Dr. Schumacher's research focuses on improving lives of children with heart disease through clinical research, with a particular emphasis on patients with Fontan physiology and heart transplant recipients. Drs. Cousino and Schumacher have collaborated over the past 5 years to understand and improve psychosocial care for patients and families with heart disease, including those with cardiomyopathy. Together, they serve in leadership and advocacy board roles for a number of heart organizations, including Cardiac Networks United, Enduring Hearts, Action, and others. So I want to thank you both for being with us today. We're looking forward to the results of your research study. And at this point, I am going to turn the screen over to Dr. Cousino. Let me see. I'm going to have to, okay, great. All right, thank you, Dr. Cousino. You can take it over. Go ahead.
All right, thank you. Well, thank you so much to the Children's Cardiomyopathy Foundation for having us and for all of you for joining us this afternoon. We're really excited to give you an update on a study that may have come across your Facebook page or Twitter and that you might have even participated in regarding psychological stress in our pediatric cardiology patients and families as it relates to the COVID pandemic. So I wanted to start with a little bit of background on how Dr. Schumacher and I came to doing this research. So we're both leaders within our heart center, and we're sitting on many early morning COVID calls for our heart center when we were really at the peak of the pandemic here in Michigan. And one thing that kept coming up on these calls were questions and concerns that parents and patients were calling in on. And Dr. Schumacher, you know, we've been working together for a number of years, texted me and said, we really need to better understand this so we can better support support our patients and families here at our Heart Center. And so we were thinking, maybe we can survey our long-term follow-up sample of patients in Michigan. But then we were thinking, well, there's certainly families who've had surgeries and caths and procedures that have been planned and delayed, and how are we going to capture those? And, we recognized as we're participating in calls with learning networks and our colleagues across the country that we certainly were not the only center where these questions and challenges were coming up. And so that led to our national/international study where we wanted to assess the psychological stress of pediatric patients with a variety of heart diseases, including cardiomyopathy, and adults with congenital heart disease. So the patients that we serve at our Heart Center broadly as it related to the COVID outbreak. We also wanted to assess psychological stress in caregivers and parents of children and adult patients with heart disease. We wanted to look at what disease-related or medical care correlates. So, are patients with certain heart diseases, certain ages, areas of the country that may be associated with stress or impact of COVID on their heart care. We wanted to really determine the degree of medical care disruption for pediatric cardiology patient populations as it related to COVID. And really, and very importantly to our center and to our planning is what is the mental health needs, what are the support needs of our patients and families as it relates to COVID, so that we can improve the care that we're providing, making sure that we are meeting the needs, recognizing the incredible stress that patients and families were under. So we did this really rapidly. Sometimes, I think one of the big issues with scientific research is that it can take a lot of time. So, we're developing studies, getting IRB approvals, et cetera. This is something that we did very, very quickly. It was kind of a quick and dirty study because we wanted to get the results so that we could really improve care as rapidly as possible. So we wanted to develop a survey that was quick, that was generalizable, so that could be used for parents of a baby to parents of an 18-year-old. This was administered via Qualtrics, so it was easily accessible. And it focused on 6 domains. So demographic and disease info, the impact of COVID on heart care, where patients
Dr. Cousino, I think we've lost your voice. We can't hear you. Dr. Cousino?
Melissa,
again, we were really,
Okay.
oh, go ahead.
we lost your audio about 30 seconds ago.
Oh no. Okay, can you hear me now?
We started, I think you were at quick and generalizable, so you can move on.
Oh, oh gosh, I'm sorry. Okay, here I am. So we administered the survey via Qualtrics, and the survey included 6 domains. So demographic and disease information, the impact of COVID on heart care, so appointments, surgeries, et cetera, where patients and families were getting their COVID-related information, concerns patients and families had about COVID in general, but also the impact of COVID on their heart care, general stress in patients and families, and then support needs of our patients and families. And again, because this was a very generalizable survey, our respondents included a wide range of patients and families. So a parent of a child or a young adult with congenital heart disease, cardiomyopathy, or transplant history, an adult with a congenital heart disease, or a partner or spouse of an adult with congenital heart disease. This is a sample of our recruitment, which we recruited through social media over a 3-week period. So this is just the number of organizations that had agreed to kind of share our survey with their membership and with their social media community. So special thanks to Children's Cardiomyopathy Foundation for being one of the organizations that helped us with sharing our survey. And again, to all of you who participated. We were really overwhelmed by the response of organizations and their memberships to participate in this study. All right, I'll pass it over to Dr. Schumacher.
Yeah, I just want to echo before I keep going what Melissa said. So thanks to CCF and all of the organizations. I think for studies like this, it's remarkably important to partner with the actual patients and parents who are working on these things and who are working through these issues. We work on these things, but you guys actually have to deal with it directly. So we are extremely appreciative of the help that we got from all of these organizations to try and gather this information so that we can do better. And we really did a remarkable job of getting responses. So as you can see, we had over 1,200 people participate in our survey in the 3-week period that it was open. So these are all children or parents of children or adults with congenital heart disease. More than 1,200 across 25 different countries. And you can see markers for all of the different places we got responses from. So a remarkable response. So I'll just go through exactly who we got responses from. As you can see, the majority of them were from parents. 70% of our total came from parents, but a pretty high percentage of them, almost 30%, were actually young or patients who also have cardiomyopathy or congenital heart disease responding. The average age of the patient who the parent or caregiver or whoever responded was responding was about 10, but a wide range. This is just a quick slide to show where people came from. As would be expected based on the organizations that shared with us, most of the responses were from the United States. But 7% of that 1,200 were from around the world, with the majority of those coming from Canada or the United Kingdom. As far as the respondents within the US, the majority of them came from the Midwest, but we really had a pretty even sample from around the country and the different regions that were involved. And remember, when this came out, actually COVID was affecting different places differently. This was in the spring. So we were happy to see a wide response from across the country and not just from COVID hotspots, because I think this will make it more generalizable to all of the patients we encounter. So here's what was going on. Here's the type of heart disease, the patient, and where they were. The majority of patients were not in the hospital, although 45 patients actually were in the hospital at the time that they completed the sample. And then in terms of the type of heart disease they had, you can see the majority actually were congenital heart disease with a very robust response from the single ventricle congenital heart disease community. But a really significant number, based on the amount of heart disease we see, actually came from cardiomyopathy patients with more than 5%. And those were both parents answering and also adults answering. So a good response to cardiomyopathy patients, and also a pretty sizable number of patients who had undergone heart transplant and may have been patients who dealt with cardiomyopathy in the past. So these are slides about actually how COVID and the pandemic surging forward actually affected heart disease, or actually affected their heart disease care. You can see 141 patients, almost 12% of the sample, actually had a surgery scheduled. And many of those surgeries were delayed. An almost equal number of patients had a catheterization, a cardiac cath scheduled. And also a high number of those caths were delayed. So many people had their invasive procedures that are often necessary, or at least somewhat pressing, delayed because of the pandemic. Even more striking was how many people had clinic appointments. I don't think it's surprising that a lot of people had clinic appointments coming up at the time of the pandemic, especially the spring, summer. It's a busy time for pediatric heart disease clinic appointments. Almost 75% of people had a clinic appointment coming up in the next several months. Nearly half of those people had their clinic appointment delayed, even as early as we were doing in the spring. So significant barrier to the standard clinical care that people were receiving. And at that time, a minority of patients, only a quarter of patients, were offered a video visit or some sort of alternative visit that wasn't an in-person in the hospital visit.
All right, so we also asked patients and families where they were getting information about COVID from. And so you'll see here, 40% were receiving some type of general information from their heart center or from their care team. Only 21% were receiving really patient-specific information about COVID and their care. So information really specific to transplant or really specific to cardiomyopathy, for example. So a lesser percentage than we were expecting. The majority, 68%, were receiving information from heart groups and social media. So from organizations like Children's Cardiomyopathy Foundation, who really have been the go-to and getting people and getting these webinars happening for patients and families. This is really where patients and families were getting the bulk of their information. We asked about heart care and health concerns. And so this is the percentage of the sample who said that they were moderately or very concerned. So we asked this question across a 5-point scale, with 3 being somewhat, 4 being moderately, and 5 being very concerned. And so we only kind of took out those that said they were moderately or very concerned. And you can see here, this largest bar, 53% were moderately or very concerned about coming to the hospital or clinic for in-person heart care. So this was by far the most prominent concern among the respondents. However, 28% were also really concerned about not being seen in person. So, you know, and these worries can certainly coexist. It can be very worrisome to come for in-person care, but also, as our patients and parents were telling us, they were very worried about care looking differently or not being able to see their cardiologist or have the procedure that they were wanting. Postponed clinic visits, harm due to patient due to postponed care, that was seen in 20% of our patients and families, again, with moderate or very high level of concerns related to these things. Obtaining meds was less of a concern, although when we looked at this by disease group, our transplant patients and families had much higher concern about obtaining medications, understandably, given the importance of their medications. So we, of course, were really interested in how COVID was impacting the mental health and the stress of our patients and families. And so this is a hard to read slide here, but I wanted to just give you a snapshot of what measures we used. So these are 2 general stress measures from the National Institute of Health. And one is a parent-reported measure of psychological stress in their child. So remember, we only had parents reporting on the patients who were under 18. So parents were reporting on the stress that they were seeing in their child with heart disease. And then the perceived stress scale, this was completed by parents themselves, as well as any of our adult heart disease respondents. So 2 measures of kind of general stress. We saw very high levels of clinically significant stress in our respondents. So parents were reporting that half of our population of children were experiencing clinically significant levels of stress, and 42% of both of our parents, as well as adult patients themselves, were experiencing clinically significant stress. So many have asked me, you know, how does this compare? So just looking at stress measures in the New York area related to the pandemic, these findings are at least 4 times higher than what the general public was experiencing in the New York area during the pandemic. The stress measures were not the same exact measure, so kind of comparing apples to bananas here, but our heart families, our heart patients are experiencing understandable and considerable stress during the pandemic, even greater than what the nation is experiencing at large, which of course, you know, I don't think is surprising, but I think is just a really powerful and impactful finding. So then we also asked, you know, what is it that would be helpful to you, to your child, during this pandemic and in the months to follow. And so one thing that was really clear is that 60% of the sample said they wanted more info. So they wanted even more webinars, more information about COVID-19 and their heart care. So an overwhelming number saying please keep giving us more information about this. About a third of the sample wanted more information on managing mental health and stress. So this is, again, I think a really big number of people saying we need more help with this area. Increased check-ins with their cardiology team was also commonly endorsed. And then about a quarter of our sample saying that they wanted increased access to psychology support, so mental health support. This is, again, I think this was a really powerful finding for us. 25% of 1,200 saying they wanted increased access, even more psychology support, was really a huge kind of takeaway for us in terms of how much our families are needing. So what are the next steps of this? Well, we've made some changes at our Heart Center. We've shared these findings really broadly. So while the paper is under review for publication, we quickly disseminated these findings to all of the organizations that participated, to our colleagues at other heart centers. So what was really important to us is that these findings were getting out there and we were able to hopefully implement some changes for patients and parents to support them throughout this. So one thing we learned is we really need to improve our direct communication about COVID to our patients. So, increasing messages that we're sending to the portal, information flyers, what are we saying when people call our call centers, making sure that those that are answering the phone can answer some of these really important kind of top of mind questions for our patients and parents. So that was one thing that we were doing at our center, and I'm sure is being done elsewhere. We also wanted to improve communication and understanding about what is the safety precautions going into returning to care in the hospital. What is the risk for patients and families? And so, our hospital is now starting to publish how many patients are currently in the hospital with COVID. Just recently, they've started adding how the positivity of symptomatic patients versus asymptomatic patients. And so getting that information out there to our entire kind of patient population about what current COVID is looking like in our hospital. And I think that's really important for parents as you're thinking about returning to heart clinic or to procedures. Certainly continuing virtual visits, there's a lot of room to increase those, and to, even if it's touch points as opposed to the medical visits, that was seeming like something parents were wanting more of through this study. And then continuing to partner with heart organizations to provide information, because that was a huge need of the respondents. So again, thanks to CCF and others who are doing these webinars, because that is certainly of need for patients and families. As it relates to mental health care, there's a lot of opportunities for growth there as well. And so we want to make sure that we're providing resources for self-care and self-coping. And so we are doing webinars related to this topic as well. Our hospital did an 8-series webinar show on a number of kind of child topics during the pandemic, and families. That was hugely attended, and so we want to continue to promote those at our hospitals, through organizations, and nationally. There's certainly opportunities for us to further develop heart disease specific mental health interventions and tools, and thinking about how we get them to our patients and families in a way that's accessible and meaningful. And then, one thing that we have been really advocating for is that as hospitals are forced with financial impact of COVID, maintaining at least their current level of mental health care support. So the access to social work, access to psychology was clearly an important finding from this work that we were doing. And so that has been part of our message as we share these results, is that this is not an area where hospitals can afford to make cuts, and that we really need to actually advocate for growth and expansion in these areas, pre-pandemic, but even more so now. We have been talking about phase 2 of this survey now that we are later in the pandemic. I think something that's also really important to note is that when we did do the survey, there was nothing about MIS-C that was out yet, so the post-inflammatory condition. So our survey closed really kind of that week that the news and information was coming out about MIS-C. And so certainly, when that was at its height and when information was coming about that. And now that we're months into this, stress, impact on heart care, et cetera, all may be different. And so we've been talking about a second phase of this research. We are really committed. Kurt and I are having multiple conversations about mental health-based interventions related to this and how we can share and disseminate those widely. And then, as I mentioned, continuing to advocate for mental health resources, given just the really notable stress that we're seeing in our patients and families. All right. So, yeah,
speaking of stress, this is now outside of our study, but we guessed that back to school would be at the front of many of your minds who are joining us today. So we thought it would probably be good to just give you a little bit of information about what's been published, what's not published, and thoughts about going back to school. And I do want to say right up front that going back to school is a very individualized process. It is something that you need to talk about with your own providers at your own center, because across the country, all the situations are different, and across the span of different heart disease, and in particular cardiomyopathies, exactly who the patient is, what their heart disease is, and what the risks with that are different. So we'll talk about this, but I do want to make sure people understand that this is a topic you need to talk about with your own cardiology team. That being said, there are so many things to consider when we're talking about going back to school. Among those are, what is the state of your own community? Is COVID really under control there, or is it building? And that needs to be taken into effect. As I said, the actual health of the child and the family, for siblings especially, needs to be taken into account in terms of the risk of what would happen if somebody were to contract coronavirus and develop COVID. What is the school mitigation plan? What has the school done to prepare for COVID and the potential for outbreaks within the school, and to protect against those things? Every school system has different feasibility of virtual remote learning. I think it's definitely remarkably ramped up across the country, but still is not in place in every place. Can you have virtual school learning in your community or in your school system? It needs to be taken into account. And then what would the child benefit from being in school, the social and emotional needs of the children? Clearly, some kids will thrive in the classroom environment that would not do well with homeschooling. And that does also need to be taken into account. And if it's going to be emotionally devastating not to be in school when other kids are, that needs to be taken into account too. And that should be balanced against the physical risks. Right along those lines, the academic needs of the child, and whether homeschooling is something that's going to be successful or whether it will be disastrous to be in that environment, and how can you better prepare for those things. Many schools are trying to roll out additional school-based services. So in addition to only virtual classrooms or in-person classrooms, what sort of tools are available to help with learning that are through the school system, particularly for kids with IEPs, and what sort of things are available from that perspective. And then when you're talking with your cardiology team and your providers, remember that you're part of that team also. And the child and family preferences need to be factored in as well in terms of what you want and what you think. So what's out there in terms of actual medical, professional, and psychological professional resources that can help guide all of these decisions? I'll be very honest with you, and I was just talking with Melissa about this early. It's shockingly little, and I imagine many of you have discovered that already also. There is just not that many clear guidelines and clear communications about how we should approach back to school for children who may be medically complex or have medical issues that need to be counted in. One of the only documents, actually, Dr. Cousino participated in writing that is now out there, came to us very recently, just actually at the beginning of this month, in the Journal of Pediatric Infectious Disease Society, which was looking specifically at return to school for for children who had a solid organ transplant, so a heart transplant or a liver transplant or kidney transplant or other solid organ. That is not directly relatable to the cardiomyopathy population, but there are many crossovers and many points that we probably can take. And this is really the best document that's out there talking about children with medical issues going back to school. So it's important to think about. I will summarize for you some key points from that. So what that group of pediatric infectious disease doctors, other transplant doctors, and psychosocial providers like Melissa said in terms of going back to school were really the following. First, in order for somebody who has clear medical issues to go back, there should be low community transmission, meaning that in your community, cases need to be steady or falling, and at a level where the number of people accruing new cases per day is actually steady or low. So you need to gather information really on the community basis. Even looking at your state-only calculations of how many new cases are coming up may not be enough. In different communities, different practices will be in place and different amounts of coronavirus. So the amount of COVID developing in your community should be low for a medically complex child to go back to school. Next, the school needs to itself be providing you with information about the public health measures that it's taking. And the school should be working with public health officials and public health resources in terms of how they're mitigating the risk in the school. The specific things that the school should be able to comment to you about are as follows. There needs to be things in place to promote physical distancing. I know in a kindergarten and first grade class, that sounds like it could be pretty, it can sometimes be challenging to do, but the school needs to tell you how they're going to try and do that. Physical distancing, ideally, as you probably have heard over and over again, is 6 feet. There's some data to suggest that in kids, 3 feet may be as acceptable as 6 feet, particularly if somebody was wearing masks, or particularly if everybody was wearing masks. But there needs to be some form of distancing in place in the classroom environment. Next, masks. Everybody should be wearing masks. And I know that it can also be challenging. Melissa actually has become somewhat of an expert on masking in small children and maybe can participate a little bit in how we talk through that. But masks should be encouraged in all people. In terms of what type of mask to use, if everybody is wearing cloth masks, that's probably okay. If not everybody is wearing masks, actual medical surgical masks are better performing, and probably the medically complex child, the person with cardiomyopathy, should use a surgical mask if possible. But again, if everybody is wearing a mask, the standard cloth mask that most people are wearing in the community is probably acceptable. School needs to talk about hand hygiene for everybody who is there and frequent use of hand hygiene throughout the classroom. So those Purell dispensers and hand washing need to be available, easily accessible, and frequently used by everybody in the classroom. There needs to be a plan in place about how often the classroom is going to be cleaned and how often disinfection will happen. And there needs to be a very clear policy about excluding anybody who is ill, whether that is a staff or a child, with any amount of symptoms needs to be taken out of the classroom environment and followed. They really can't come to school. Those are the core basis, actually, of public health responses throughout the country, but particularly for schools. So physical distancing, mask, hand hygiene, cleaning and disinfection, and mitigating illness and exclusion of illness are the things that your school system needs to have a very clear program for in order to consider going back into school. And now, once again, all those things should be in place, but this is where the actual patient in the conversations with your cardiology provider comes in. Patient needs to be deemed what we would say is low risk. Now, in the paper from the solid organ transplant group, there's a lot of criteria for who is high risk, who is moderate risk, and who is low risk. It's not directly, as I said, generalizable to cardiomyopathy, but in general, somebody who has not symptoms from their cardiomyopathy and who has stable function would probably be deemed low risk. Somebody whose heart function has recently been deteriorating, or somebody who has symptomatic heart failure, is probably going to be moderate or higher risk. And those are people who should really be strongly about whether virtual learning would be a better situation in terms of what we're dealing with right now across the country. And then again, child and family preferences, abilities, and needs need to be factored in. And actually, the infectious disease doctors state this really clearly. It's hard to apply a blanket one-size-fits-all protocol for everybody in terms of their learning. And there are some children who may be slightly higher risk, but they will do so much better in the in-class environment that that's going to outweigh the benefits. So all of these things needs to be taken into account when making a decision. I know it's not an easy decision for parents. It's something that in my own family we've talked about, and I don't have medically complex children, but it's been a topic of conversation among our friends as well. So it is a major point of stress and a major point of thought for many people out there, and we recognize this. And please don't hesitate to engage your own cardiologists about this as well.
And so as it relates to stress and child coping, we wanted to just include a few things related to this as well. And certainly we can talk more about this during the Q&A, but these are some of my general tips. So it's important to explore your child's feelings about things. So, as it relates to school, you can ask them, how are you feeling about our back to school plan? How are you feeling about football season being canceled, or about not being able to go on that trip we were looking forward to, or about, going back to the hospital for our clinic appointment. Validate those feelings. So as I've been saying throughout this entire pandemic, and really what I've said to heart families that I've worked with for years, is that these are sadness, anger, worry. Those are normal responses to abnormal life circumstances. And so the worries, the distress, the anger, the upset, all of those feelings that you and your child are having are really normal responses to a number of abnormal things that are being asked of us and that we are being faced with. After you validate your child's feelings, though, and say, you know what, it's okay to feel sad, or I feel worried about this too, then provide them with some modeling of coping skills. It helps me to do X, Y, Z. It helps me to take a walk. It helps me to call a friend. So let them know that those feelings are normal and okay, but then model for them how you, as their parent or caregiver, engage in some healthy coping skills. Engage in problem solving. So, as it relates to school, this is a really good opportunity to talk with your kid and say, so, in springtime, we were all shut down throughout the country in terms of school and had to make a very quick transition. So ask your child, what went well about that and what went poorly about that? Like, what was hard, and engage them in the problem solving about thinking about how this school year might look differently. We very much promote routine, although as a parent working in this pandemic myself, I appreciate that routine is very, very hard. But as you are able to promote routine in your child, when so much around them feels uncertain and unpredictable, promoting some sort of routine at home is really, really important to their overall well-being. We want to identify the positives. And so, I think that this is not something I'm saying you should falsely sugarcoat all that's going on and say, oh, look at all these wonderful things that are happening, because that can be really not validating for how hard it is. But certainly there are some positives as it relates to COVID and changes in our family lives and in our world. And so helping them to identify the positives can really promote some resilience. And then please seek help from your healthcare teams, from your pediatrician, from your school. If your child, if their behavior or their emotional distress is impacting their ability to do their daily activities. So they are so sad that they're not able to get online to do their, classroom work, or they're so distressed that even when you offer something that they normally would like to do, they're just not wanting to do it. That's when we would want you to call your PCP, your heart team, your mental health provider, and get some more support for your family at that time. All right, so we want to thank our team that helped us with our large study, and again, to all of the organizations, patients, parents, advocates that helped to share the survey. We really, really appreciated that. And I think with that, we're ready for some questions and discussion.
Okay, we have a couple of questions, and if anybody else wants to ask a question, please just type it into the question box. The first question we have is, how important is that our child's school has a ventilation system with a MERV score greater than 13, which filters out coronavirus, ultraviolet light, etc.?
Yeah, that's a good question. We don't know the answer to it. Is the true response? I will say that I know where we work in Ann Arbor, Michigan, none of the schools meet that criteria. And Ann Arbor is going all virtual, but it's not it's not because of that. In terms of the overall ventilation system, I think the school infrastructure in the country, many places probably do not meet that. But again, ventilation systems are not the main public health priorities in terms of preventing transmission to put in. Certainly, if every school could have that, I think it would be fine. But if the rest of the public health mitigation factors that I talked about are in place, then I think that lowers the risk as much as anything probably could. In the documents I've read and things that have been released, actually ventilation systems are never talked about. They're never really discussed in terms of what is out there and published. So while I can't say it's not important, I think if everybody could have a really well ventilated, highly developed ventilation system in a school, that would probably be better. But that's an impossibility in our country with the infrastructure the way it is. And there are other ways to prevent transmission. In general, we still believe that coronavirus is primarily spread through large droplet, which is something that's not actually going to make it into the ventilation system and not going to be transmitted. The amount of aerosolized coronavirus that's still out there is really thought to still be minimal. So ventilation systems probably won't make a huge impact.
I'll also add from the transplant guidelines, and that paper is freely available. So the journal has actually made it free open access. So any parent, patient, et cetera, can Google that and find it and read the scientific paper in full. But one thing that we suggested as part of that group is for our medically complex patients and families, if the school is unable to do kind of all of the mitigation factors that were recommended, the biggest one being distancing. I think that's going to be the hardest for some schools and for some classrooms. You could use or work with your school, whether it's through an IEP or a 504 plan, or just working with your school leadership to implement some special things for your child or within your child's classroom. So, maybe the school is not able to do 6 feet distancing for all of the desks, but for the classroom where our transplant recipient is, they are actually able to move our transplant recipient 6 feet or more away from other students in the classroom. So, there's some suggestions in that paper that talk about, here are all of the recommendations, and then even some of the kind of what ifs, if some of those recommendations aren't able to be implemented in the school. And as Dr. Schumacher mentioned, ventilation was not part of the considerations in that guidelines paper either.
Okay, great, thank you. We have another question. How do these return to school guidelines apply to older cardiomyopathy kids who are going back to live to college campuses and live in dorms?
Yeah, I was figuring we were going to get this question and trying to decide how I would answer it. I don't think we know the answer. A week ago, I would have said we will follow the same guidelines, and most universities and colleges have taken on pretty aggressive testing and mitigation procedures, and I think we would just have to see how it goes. I will be very honest that just in the last few days, I've become increasingly concerned about these things. The University of North Carolina, back in class for 2 weeks, has shut down and gone all virtual. Notre Dame just shut down. Many other universities are doing the same thing with the kids who are back on campus. I really don't think we have a good understanding for what's going to happen in the university environment. For that reason, I would say if this is going on and virtual classes are a possibility, even if they go back to the dorms, minimizing the amount of interaction they have, at least at the beginning, probably is a good idea. I think many of the universities and colleges out there are doing their very best to minimize the risk of transmission in the actual university setting. And actually, if you dig into the outbreaks at UNC, it looks like they came from parties a lot of the time. And so speaking very clearly with your college age child / young adult about the fact that, it's still going to be up to them to make some really clear choices about what they do and what they don't. I think it's asking a lot of college kids to say, don't go out and party and don't spread your wings and exercise a little bit of freedom. But particularly for the person with risks, at least having those conversations about trying to make safe choices are going to be really important. Again, it's going to be somewhat of an individualized choice in terms of letting someone be a young adult and move out there. But I have concerns. I do think we have to watch the university setting and the college setting very closely. And on an individual basis, talking about minimizing risky situations as best we can is probably what we have to do.
Okay, thank you. Do we have any other questions from anyone? You can just put it in the question box. And if not, I want to thank both doctors today for sharing their time and expertise and for sharing the results of the research study. We're looking forward to, when you continue your study, getting more information. And we really appreciate that you can join us today. So if you want to find out more about the Children's Cardiomyopathy Foundation, we encourage you to visit our website at children'scardiomyopathy.org to learn about our organization and to review any of the resources that we have available. Today's webinar, just want to give a reminder, will be available on our YouTube channel. It's called CCF Heart Kids. And I want to thank everybody for joining us today, and I want to wish you all a great end of your summer and a safe and healthy school year. Thank you.
Thank you.
Okay, bye-bye.